I'm joined here now by Hidal Patel and Elizabeth McQueen, and you guys are both of the newly named Aspire Behavioral Health Services, which was formerly known as the Albany Area Community Service Board. Now, first question we have to ask, why the name change?
The name change took effect January 1st, and the reason for the name change is because we're trying to present ourselves as a more connected, more current behavioral health service center that meets the needs of all of the consumers from our 8-county catchment area.
Absolutely. Now, you again, 8 counties that you guys cater to. You're a nonprofit. Let's talk about some of your services. Let's talk first about outpatient services that you offer to the community.
We have various outpatient services, including diagnostic assessment, a nursing assessment, individual, group. We also have family therapy, group therapy, individual, like I said earlier. We also have all of the services that we take in clinic. We also take it out in the community through our assertive community treatment team. So all of the services that we provide in a clinic, we take it all in the outside clinic. We also have day programs such as psychosocial rehab programs. We have peer support programs. We also have community-based programs where paraprofessionals or skilled staff go out in the community and provide community-based services such as psychosocial rehab individual, addictive disease support services, peer support services, individual. So those are the services that we take to the community where people are. So those are our outpatient services.
Absolutely. Now, out of those services that you offer, it's a variety, like you said, of developmental disability services, addictive disease services. What do you see the most of in the counties that you cater to?
We probably see more outpatient, severe, persistent, mentally ill consumers. That's our largest population. Mm-hmm. So you're talking about consumers that have schizophrenia, major mood disorders, bipolar disorder, that really affect their functioning. And so the outpatient services work to help them restore their level of functioning. Right. We also offer inpatient services, though, for the consumers that are so very severe that they can't function in the community. Mm-hmm. And this has been an expanding area at our Community Service Board. We have had our crisis center for many, many years, but we've added to the crisis center a observation unit where people can come in and be observed if we don't feel that they're safe enough to return home, and then some respite apartments and some other crisis services.
Right. Now, for those watching who are listening to this saying, that might be something I can use either for myself or for a loved one, what would you encourage them to do?
I would encourage them to call or come into the center. We have a walk-in clinic called a navigation unit where people are navigated to the most appropriate level of care. Mm-hmm. They can reach services by calling our main center, area code 229-430-4005. If someone is interested in learning more about us, we do have a speakers bureau where we can come and talk to your organization about mental health issues and our services.
Excellent. All right. Well, thank you so much for joining us. And we're going to have more on this a little bit later. We're going to get specific with some of the services that you guys do offer. We appreciate your time and we appreciate you coming in. Right now, we're going to go to a break. Stay with us, though. Good day. We'll be right back. All right, thanks, Chris. I'm here with Deneen Burnett and Lisa Spears, both of the Aspire Behavioral Health Services, a nonprofit locally formerly known as the Albany Area Community Service Board. And what we want to do now is we talked about earlier kind of what you guys do, but we want to get specific. Now, Deneen, you are the Developmental Disabilities Operations Manager. Yes. For the patients that you work with, it's mostly about developing independence among those patients, is it not?
Absolutely, developing independence so that they can live lives as normal as yours and mine.
Right. And what do you see a lot of, and what is the process for treating people who come into your office?
The people we serve have conditions that range from an intellectual disability to those who may have autism. In some cases, we serve individuals who've had traumatic brain injuries or who've suffered from cerebral palsy.
Okay, excellent. Now, Lisa, you are the Child and Adolescent Coordinator for the Dougherty County area.
Right.
Now, the first question I have for you is, you probably see a number of issues coming through your office, but behavioral issues are probably one that I feel like a lot of parents would want to harp on, because that is something that I'm sure that, correct me if I'm wrong, you see all the time.
Right.
For parents who feel that their child does maybe have some sort of behavioral issue, what would you recommend to those parents?
Well, families can walk in and receive services from us, so they actually can refer themselves for services, and we have various services that can help families with their children with behavioral issues. And so we have therapists who can work on behavioral plans. We have therapists who can also help with some parenting skills.
Absolutely. Now, do you guys deal mostly in diagnostics, or treatment?
Treatment.
Treatment.
We do have a psychiatrist who is there, a board-certified psychiatrist who works with children with various different mental health issues, and she does do the diagnosis piece, but we do a full service of treatment.
Absolutely. Now, the number, we want to give people that number one more time. It is 229-430-4005. That is the number to get in contact with you guys over there at the Aspire Behavioral Health Services. So thank you guys very much for coming in. We appreciate your time. And of course, as you recommended to parents earlier, those who feel that this might be helpful for them, we encourage them to reach out to you.
Absolutely.
Because you guys do an excellent job over there. So thank you very much for coming in. We appreciate your time. For right now, though, we're going to head to a break. Good day. We'll be right back.